Hi, I'm Senthil Velayudham, consultant orthopedic surgeon here at the Horder Centre, specializing in hip surgery. Hip joint is a ball and socket joint. The socket, the surface of the ball are covered with a smooth cartilage for a smooth, pain-free movement. On the X-ray, it is seen as a gap between the socket and the ball of the hip joint. Cartilage wearing out is hip osteoarthritis. As you can see, the joint space is completely narrowed, so the bone is rubbing on the bone. That's advanced osteoarthritis. Pain and stiffness are the main or common symptoms. Other symptoms can be clicking sensation, limping, and difference in the leg length. In the early stages, painkillers, regular low impact exercises, and maintaining healthy weight help to ease the pain. As the arthritis progresses, these measures might not help the patient. Advanced osteoarthritis affects quality of the patient's life, restricting their day-to-day activities, ability to do fitness exercises, and have a good sleep. When the arthritis reaches that stage, probably one would need a total hip replacement. When to have the hip replacement is entirely patient's choice, so they can decide when they want to have a hip replacement. Only occasionally the surgeon might advise the patient to have the hip replacement done sooner than later. Restoring soft tissue function is a very important part of a hip replacement. Minimal invasive hip replacement helps to achieve this by protecting the major muscles and repairing the ligaments as anatomically as possible, so that a patient gets back as good function as possible. This also helps to reduce the blood loss, reduced pain post-surgery, and earlier recovery of the hip function. Equally important are choosing prostheses with good long-term record, securing the prostheses, that is fixing the prostheses as well as possible, restoring individual patients' hip anatomy in terms of leg length, soft tissue tension, etc. All these are important, achieving early and long-term good to excellent outcome. Though the hip joint has been replaced, the muscles around the joint are the same. It is important to maintain good strength and flexibility in these muscles to enjoy the new hip replacement as long as possible. It's better to follow the advice given by the surgeon and the physiotherapist, doing exercises in the early stage. Around 4 to 6 weeks, patients can start doing water-based exercises including swimming, static bike exercises, gradually increasing the resistance and endurance. Any lateral or pivot movements involved sports activities are better avoided for 3 months. Around the time one can start playing golf, tennis, badminton, or horse riding, etc. High impact exercises are better avoided for at least 6 months. Elderly patients having falls after the hip replacement can lead to fractures which might need revision surgery. So it is important that falls are avoided. Regular balance and flexibility type exercises help to achieve this. Any infection should be treated promptly. Otherwise, even at very late stage, infections such as dental infection, bladder infection, or chest infection can spread to the artificial hip joint and cause infection there, which may need further surgery.